I want to thank everyone for joining us today. You're looking at a number of physicians, people who've practiced medicine around the country in their home districts for many years. I'm John Barrasso from Wyoming, an orthopedic surgeon, taking care of the families around the state of Wyoming for the last quarter century, and serving now in the United States Senate. And I can tell you, as a doctor, the simple truth is this health care bill is bad for patients, it's bad for providers, our doctors, our nurses in our hospitals, as well as it's bad for payers, the American people who are going to end up having to pay this bill. You take a look at this, and the President continues to talk about making sure more people are covered. But that doesn't mean more people will get care. And there's a fundamental disconnect when he says he's going to solve this by putting 15 million more people on Medicaid. A program, there was a front page story in the New York Times 2 days ago where it said both doctors and patients are dropping out of Medicaid because the reimbursement is so low. A program where in the Seattle Times yesterday, going coast to coast, the Walgreens drugstores, 131 of them, said we don't want any new Medicaid patients. When the President a year ago started talking about the Mayo Clinic as excellent care, it is excellent care, but they can't afford to see patients who are on Medicare or Medicaid because the reimbursement is so low, and all of the hospitals are going to be facing that in all of our communities. So I'm delighted that all of you are here to listen to our comments. We're going to hear from physicians who have a great deal of experience. In Wyoming, I took care of a number of patients from Canada, people that have come from Canada for health care. It's not just the member of Parliament or the Premier of Newfoundland who comes to the United States for care. 33,000 Canadians last year came to the United States for surgery because even though they had coverage in Canada, they couldn't get care because the waiting lines were so long. And it wasn't just there. In Massachusetts as well, the waiting time now is 42 days. 42 days to get an appointment to see a family physician, and it is the most expensive insurance state in the country, and they're the ones that have a health care system that is closest to what the President and the Democrats are trying to force through Congress. So we have better solutions. We believe we need to go in a step-by-step process. The President this morning is signing a jobs bill. He said the first of several. Well, that's what we ought to do with health care. Go step by step in a positive direction with solutions that we know work for the American people, not a $1 trillion bill that cuts Medicare by $500 billion from our seniors who depend upon Medicare for their health care, not raises taxes by another $500 billion, and a bill that is absolutely loaded with sweetheart deals. And yesterday on Fox, the President said that the Louisiana Purchase is going to stay in no matter what happens. That's what we're dealing with. So thank you for being here.